strange, but they'll have that figured out.
Sounds good.
Okay, so we have about, I'm going to say about 3 more minutes. So I know Dexter is in Virginia, and Danielle, where are you calling from? I think you're in Maryland, if I'm correct, right? You can also type in the chat if you're not able to use the microphone there. Okay, Dexter says he is well. I'm glad to see you well, Dexter. I hope everybody's doing well. And let me announce, guys, I am going to record this session. The main reason I'm going to record this session is I do think we're going to have some good questions, good things discussed, and I'd like to make that available for other people who are not able to join. So this means one of 2 things, right? I do want this to be an open session, but if you're not comfortable asking a question or sharing something that might be made public, right? Then don't share that, right? You can always contact me offline, and once you contact me offline, I can then give you some answers to those questions or give you some feedback there. Does anybody have any issues with this session being recorded?
Nope.
Okay, so Melba, I think from what I can see, you're trying to show off the fact that you are in somewhere very, very bright and sunny. Here in Shanghai. Go ahead.
Yeah, I'm just sitting here on my patio. It's, it's only 5-something here, so still daylight.
Wow. Wow. It looks like it looks like a vacation. I know this time in Shanghai, we usually have, I would say, about a month and a half of gray, right? So there's no sunshine outside. It's just gray, but we're very much used to that over here. Okay.
Gotcha.
Deidre. Oh my God, we've gone from the US too long. Deidre, how are you? How are you doing?
I'm well, you. I'm
doing great. Welcome to the webinar.
Thank you.
Yeah. Okay. So we're all going to get started in a moment. And Deidre, we are going to be recording the session. Are you okay with the session being recorded?
Yes.
Okay, great. Great. Okay, so let me hit the record button. All right, so guys, so we are now recording, and I want to welcome you all to what I call what we learned in China with the COVID outbreak webinar. The goal of this session is is really just to one, answer any questions or concerns that you guys have about what's taking place now in your relative country or area. My family and I have just went through, we're still going through, I think we're on week 9 here with the outbreak here in China. And we learned a lot of lessons, a lot of tips, and we decided we wanted to help as many people as we could by sharing some of these tips. So I'm going to just give you guys our brief overview. If you're familiar with webinars, typically with webinar, we have these complicated PowerPoint presentations. We're not doing that, okay? We're going to make this very, very casual. And the reason is, when we talk about something that's literally impacting your daily life, we want to talk about that in a very casual, calm manner. So I do have a brief agenda, and I'll go over that with you guys in one moment. So the agenda, I'm going to just give you a very brief introduction as to who I am. And then I'm going to go into a brief recap of what my family and I went through over the last 9 weeks here in China, and what our main takeaways, the lessons learned, were from that wonderful experience. And then we're going to really have an open forum and QA where you guys have an opportunity to ask any questions, to share your experiences so far. A lot of times we learn from each other. I will have that, then we'll do a little closing, and we'll go from there. The only request I have is that during this call, please no political talk, okay? I know that a lot of people want to point fingers, what could have been done, should have been done, but we want to keep this a very neutral forum. So no political talk on this call. Is everybody okay with that?
Yes.
Okay, great. So I'm going to ask that when you guys feel free to interrupt me at any time to ask a question. The first time you ask a question, please please respond with three things, right? Your name, where you're located, and then finally, how you're feeling. And I put how you're feeling on a color scale. Blue meaning, I'm not overly worried, I'm not overly scared, I feel great. Yellow, I'm a little concerned, and then red. And we all know what red means, right? Red means, ugh, I'm about to, I'm really starting to panic, or I have a high level of anxiety. And again, any questions or anything, please feel free to jump in. So let me change, second here to change my view. There we go. Now I have everybody on my screen. So guys, my name is Colin Thompson. I am live and direct from Shanghai, China. It is approximately 8:09 in the morning here on Wednesday, March the 25th. I have been in China for the last, I want to say 12 years. I came here with IBM back in 2008. Since 2008, I have been very fortunate. About 3 years ago, I launched my own company, a life coaching company, and a blockchain company. But that's a different thing. I have one wife. I have one wife, right? Got married in 2000. Oh gosh, 2017. 17 to 16, 2017, I believe it was. And we were very fortunate.
Colin.
We were very fortunate this past August 2nd, we had our first child. So, which is, as you guys know, the kid, which is a blessing. The downside of this is in January of this year, we started getting some reports out of Wuhan, or out of China, that there was something taking place. Initially, we didn't know what that was. All we heard was there's something taking place in Wuhan. You can say that was probably the first week of January. Within 2 weeks, we then started getting a lot of reports saying that people are getting sick in Wuhan. And one thing that's very distinctive about China is how the news is controlled. So we weren't getting a lot of news mainstream. We were hearing a back channel, news from outside of China that's saying something taking place. So we really weren't able to react accordingly because we just did not know, quite frankly, what was going on. We then went on vacation, Chinese New Year, and it was really announced by the government officially that there is a virus outbreak in Wuhan. So as you guys have started hearing about the outbreak, you heard Wuhan and Hubei province a whole lot. That was the epicenter of the virus. Now, of the outbreak, excuse me. Now, one of the I gotta say phenomenal things that the Chinese government did. Now, let me also, at the time they were doing it, we didn't think it was so positive, but in retrospect, one of the great things that they did, they were able to control. So within China, 90% of the cases all took place in Wuhan. They were really able to control the spread outside of that location. And of course, it went to almost every major city in Shanghai, in China, but didn't have the same impact in Wuhan. I know in the U.S. right now, New York, Washington State are the two main places, but you're seeing it start to pop up in large numbers there as well. Italy is getting really, really, Italy is where Wuhan is right now, quite frankly. So hopefully they'll start to see that curve. So we really had, I want to say, 3 phases in what I would call our experience here. Weeks 1 through 3, we call the terrible, terrible time. This is when, once that announcement came, overnight, literally overnight, everything for us changed here. We returned to Shanghai. The cities were shut down. In Wuhan, you could not leave. You could not leave your places of living at all. You had to have volunteers who would then go get food for you and whatnot. Luckily in Shanghai, the city closed down, meaning that if you were not a Shanghai resident, you could not come back into the city or working here. But luckily we came back early, so we were able to avoid being caught outside. But our day-to-day life really was impacted, and I'll share some experiences we had during that time. Now, what they did during the lockdown, and I know in the US right now, they have a recommended lockdown, recommended that you stay in your home. In some cities have gone forward and say it's mandatory, but it's very hard to enforce, right? Luckily in China, due to the structure here, most folks didn't want to go outside. A lot of people were very, very scared to get the infection. At that point, we didn't know how you could get it. Some folks thought you could get it just by looking at somebody, right? So we wanted to make sure that we were safe. So instantly, the streets cleared out. Most people in Shanghai did not leave their place. In my house, I was the only person to leave. My wife and child did not step outside for 3 weeks, literally for 3 weeks. And that is a long time to really just stay inside your home. Now, the home structure in Shanghai, in most Chinese cities, is a little different. We don't have single family homes. In most cases, we have what we call apartment buildings, right? Most people live in apartment buildings. So what happens instantly is now the access to your apartment is controlled, meaning that we could not freely go in. I could not freely go in and out. Each time you go out, they get your name, information, and a temperature check, right? They must take your temperature to make sure that you are not a carrier or you're not sick. We got to the point where people were so concerned about what they're seeing on TV. Again, we had two different news from China was showing one thing, but the news outside China was showing people being dragged out of their apartments and put into a wagon and taken to a hospital or somewhere. You guys may have seen that news. I'm not sure, but it's very scary when you're in the country and it's happening, but you don't see it. So we wanted to make sure that we really protect our home, meaning that there was no way that the infection would come inside our house. And I'll share some tips that we did to control that. But I got to share a story. It got to the point where if you went to the pharmacy for cough medicine or fever medicine, they had to document you. Reason being, some of the symptoms of the coronavirus were fever, coughing. And a lot of people wanted to sort of self-medicate or take care of themselves and not be known to be sick. So the government had to make sure that they were tracking those people and gave them information. So during that first few weeks, it was very, very, it was a terrible time, very, very confusing. And I hope that by sharing some of our experiences today, you guys can manage that better by knowing what to expect. Whereas through our experiences, we really didn't know what to expect. And give me a second, I'm gonna mute people here. One moment.
Yeah, can people put their mic on mute if they're not speaking?
Yeah, I'm going to take care of that. Thank you, Beth. Okay, I'm hearing somebody with some chips or something. 1 second here. Okay, and I could just mute everybody. Okay, so everybody is muted. If you do have a question or anything, please just go ahead and unmute yourself. Okay, so just to wrap up, we went through that first 4 weeks. The last thing is, when we say things closed down overnight, everything closed down. Okay, literally overnight. We woke up in the morning. The parks were closed. The malls were somewhat closed. All the restaurants, most of the restaurants were closed. The ones that were open went to a carry-out only model. Museums were closed. All tourism stopped. Even the hospitals were closed. And you say, well, how can a hospital be closed? Well, hospital was closed because they were concerned that people who were sick would go to the hospital. And at that time, the hospital employees did not have any protective gear. So what happened was, if you were sick, you could infect not just the caregivers, but also other people who were there for regular emergency or health emergencies, right? So they somewhat shut that down for a few days and then only allowed the people who thought they had symptoms. One of the challenges we have here, which you have now, is testing, right? Who gets tested? How do you know you want to get tested? And some people were scared to get tested because once you're found to have the virus, your life is very much impacted. Your family's quarantined. Everybody in your house must stay in your house. They literally put tape on your door to see if you've left during that day, and they really monitor to make sure you're not going outside. And I gotta say, guys, it does make sense because they want to make sure that they're controlling the containment. So, but they would bring you food and supplies on a daily basis. So, Right. So those first 3-4 weeks was very terrible because of the overnight change. Now we went from being, I would say, concerned, and I tell you, my wife was really, really terrified during this time, for herself, our child, and her family in other parts of China. Again, there was not a lot of news we could trust coming out, and at this time, China didn't really know much about how the virus was being spread or the infection. So it was very, very tough times. Most folks in the next week, from week 3 to about week 6, we call this the frustrated time. Okay, now we're not so scared. Right? We're worried, we're concerned, but we're not so scared because we have a process inside our house that we use to make sure we're clean, everything is disinfected. We control who goes outside the house. We now know how to get food. The grocery stores, everything that was run out of the grocery store the first week, they now have it back. So supplies are well. Only thing we couldn't get were masks. All the hospital masks were going directly to Wuhan, but we're not as concerned. But now we're frustrated, right? We're frustrated because we're not getting clear, concise information. And most of my friends and colleagues here have more than just one baby at home. So now people are really starting to go stir crazy being inside for so long. And again, when I say folks were not going outside, literally people were not going outside. Dog owners were not going outside, right? So you have to imagine, inside of their homes. At the same time, this is where a lot of people started reaching out to myself and my colleagues. I am a life coach, and we got a lot of people reaching out to us, asking them to help them cope. And there were really two areas here. One was, how can they keep their family energized, moving in their house? Now, again, the typical Chinese family has the mother, father, one or two children, and a set of grandparents in the house. So if you can imagine this in a very small environment, where typically the father or mother or grandfather will get out each day to have a little alone time. Now you're looking at 4 or 5 weeks, everybody has been inside the house. And those houses where you have those grandparents, it was much more important that nobody leaves the house. It was much more important that whoever that one person was really take care of themselves, because when they come back in, they must disinfect themselves, because at the time, older citizens, older people had a high likelihood of really passing away. So people were really, really on high alert. And now the wall was starting to close in, right? Also, you have children there who are really getting they don't understand really what's taking place, but really getting stir crazy. So during this time, we found that, again, people were more confident in how to avoid the virus, but less confident in being able to mentally and emotionally maintain their calmness, so to speak. Now, a good thing is, which I think Michelle alluded to, around week 4, I want to say the technology started catching up. What that means is, the schools started going to online learning. Initially, when they shut the schools down, they shut it down with no plan. They shut it down, said there's no more school for 6 weeks at least. But there was no plan on what kids would do to educate themselves. So what happened was, about 4 weeks into it, they started moving to online learning, which was great, because now the kids are occupied a few hours each day, right? At the same time, parents must oversee and sit with the kids for those 2 hours each day. One, to make sure they're not roaming the internet, and two, to make sure they're really doing their lessons and not asking questions. And then, of course, we had some families who didn't really have Wi-Fi, but the technology started catching up. As Michelle said again, a lot of companies started using Zoom for their employees, and not using Zoom so that they could really have these fancy meetings, but allowing the employees to contact each other, to see each other's faces. Because a lot of time, people may not realize this, but employees become part of your typical work day, and you feed off their energy. You feed off the energy, especially if you're working together. So by using Zoom, by using some online tools, we started to get to what we call a new normal. But again, the organizations who reached out to us for coaching, and I got to say that, the doctors, nurses did a great job being on the front line. On the backside, coaches, counselors, trainers, I think we did a good job as well, because a lot of individuals and organizations reached out trying to get that support. not in a psychiatrist type way, but more of what can we do going forward, knowing we don't know when things are going to change. What can we do going forward to help us manage what's taking place inside the house? Now, from our organization standpoint, it was really more about, look, our employees are not being productive right now, right? What can we do to help them be more productive? What can we do? So it was really good that organizations, bottom line, they want, production, but they really took a time to say during this time, it's really more about the family. And I think as a country, China did a great job putting family first during this time. Okay, I'm going to wrap up in a moment and get your questions and comments, right? So week 7, I'm going to say week 7 to where we are now, around week 9. I call this, we can see our way out now, right? We can now see the end. Things have started to flatten out here in Shanghai, and thank goodness they have, because I got to tell you, it was really tough here for a while. I can tell you how I really knew things were getting back to normal. I heard kids playing outside. For 6-7 weeks, you heard nothing outside. You heard birds, but you heard nothing as far as children playing outside. So really having the opportunity to hear kids outside playing with their mask on, right? But playing together, it really made us feel like things are starting to relax. And we started seeing dog owners taking their dogs outside. Now, nobody was leaving the complex. Nobody was going out the complex, but they were still outside. And one thing that was very refreshing, these kids playing never played together before. You say, well, why don't they play together? Well, in China, there's a big focus on education and keeping up with other kids. So after school, kids go to art class, piano class, weekends, school. They never really have opportunity to play outside. And kids who are the same age, 8, 9, 10, never played together before. And now, for the past 2 weeks, every day they're playing together. And I think that's a very good thing, because now they're starting to enjoy life, because hello, there are no piano lessons. There are no painting classes. All those things are shut down. So, and parents want their kids out of the house, right? So you've seen a lot of kids playing together, and parents who come down to oversee their kids talking to each other, right? So there has been some very good things to come out of there. Okay, so where we are now, the infection numbers have flattened out. People are still wearing masks. Most families now are starting to relax. The malls are open again. China is really pushing us to go out and shop again. So this is where we want you guys to get to, hopefully in a few weeks. The last thing is, the focus now is on returnees, or people coming into China. And they're really having to go to a mandatory, anybody coming into China, mandatory 2 weeks self-quarantine. And we're going to talk later about the difference between self-quarantine, self-monitoring, self-isolation, all different terms. So that is what we've went through the past 9 weeks. And I'm downplaying the amount of sheer terror we had in the beginning, because I want you guys to know that there's no need to be nervous and no need to panic. No need to be nervous, no need to panic. And if I said a few lessons, follow the outbreak restrictions and stay inside, right? Act as if either you have the virus already or everybody else outside does, right? That's the best way, because you will take all precautions to make sure your family is safe. The only place you have control over is in your home. So make sure that your home has been disinfected. And if you do that, you have no worries inside your house, and people can really just carry on. Ensure all of your family members respect your disinfection process. Make sure they respect the restrictions. You don't want one person saying, you know what, forget this, go out and bring something back in and put your family at risk. So you got to make sure everybody respects that process. And lastly, if you or your family member need somebody to talk to a family member, talk to a friend, talk to a coach, talk to somebody if you're feeling a certain way. Also, offer to listen to your friends and your family members, because you never know how people react to this. Some people are calm, and some people are really, really panicking and nervous. Okay, so I'm going to stop my part there, and I want to open up you guys to the open forum. Any questions, comments you have, I'm going to unmute your mic. So let me do that. Well, actually, just go ahead and unmute your mic if you want to talk. You should see the button there.
So, Colin, could you kind of go through what your NK's disinfection process is so that people can kind of really get an understanding of what they should be doing when they do leave the house and come back in?
Yes. So I'm going to start with the backside first. When they come back into the house, and I gotta say, Mel, this is, first of all, you see me rubbing my eyes. I gotta stop doing that, but I'm inside my house, so I feel okay doing that. I was talking about this stuff when you go out the house. So returning in the house, we had a process that we did. Actually, I did each and every time I came back home. It first started by coming inside the house, and before I even walk off the placemat, right, I'm taking off my shoes. We had a spray bottle where we spray the shoes, spray the bottom of the shoes, spray the top of the shoes, and this is a sanitizing spray, right? So it would work on contact. I think it was alcohol based, I'm not quite sure, but we sanitize our shoes. We would take off the mask. The mask would then go directly into a plastic bag. This plastic bag would then go into the garbage bag. We'd then go to the bathroom. In the bathroom, just do your clean washing of the hands, washing of the face, and I would take off my outside clothes and put on my inside clothes. Now, I had some very grimy inside clothes. I had the same sweatpants and t-shirt for days and days and days and days and days. I don't recommend that, right? but I had that. But I knew those clothes were clean. So it's very important to have that disinfection process. Now, that was what we did returning in. But I got to point out that it's important that the first thing you do is disinfect the major touch points in your house: doorknobs, door handles, your fridge, in your bathroom, everything in your bathroom, places that people touch. You want to make sure those are clean. Also, don't forget your couches, your chairs, your tabletops. If you go outside, somebody sneezes on you, or you sneeze, you rub your hand here, you now have something here, right? You sit in your car, it's now on your car seat, right? So you want to make sure that you're really taking the time to disinfect everything you have inside your home. And we did that a few times a week. Now, my wife, who was very, very nervous, she did that almost every day, quite frankly. And I supported her doing that because, again, you want to respect people's, and it kept her busy, quite frankly, right? But I think if you do that a few times a week, you should be fine. The key thing is making sure that you are keeping your house clean. Now, going outside, I would say in a family, have 1 or 2 people who go outside. They should be able to buy food. Anything else besides buying food and supplies, you don't need it right now. Don't use cash. Of course, cash carries things with it. If you can, use plastic. But when you go outside, be conscious of what you're touching, right? You'll be surprised how many things you actually touch. Some of the nasty things outside are what? ATM buttons, okay? Door handles. And if you want to be slick and say, you know what, I'm going to use my shoulder on the door handle, that's not going to help you, right? Because all you're doing, if you imagine somebody's hand is wet and they touch the door, use your shoulder, it's now on your shoulder. And now you're going to go sit in your car, sit on your couch at home, right? So, just be conscious. Now, if you're outside and you are touching things, that's okay. Just make sure back in your car, you're using some disinfectant, right? Just make sure you're doing that a few times while you're outside. Now, the next thing is but try to be conscious about not touching your mouth, your nose, or your eyes. And that's the real reason why, not the real reason, using a mask. There's 2 reasons using a mask. One is if you are ill and you cough and sneeze, you're not spreading your germs. But if you're not ill, but you come in contact with something that has something on it, on the surface, you're not touching your mouth, your nose, your eyes, right, with your mask. So you want to be conscious of really trying not to touch your mouth or your nose or your eyes when you are outside. Again, back in your safe place, your home, once you've washed your hands, taken care of everything, you're fine again. But make sure that happens. And if you have young kids, make sure that you keep them in the carriage, and keep them away from touching things, but also back in the car, disinfect. Did I answer your question, Melba? Okay, great. I think, Danielle, you said there's some questions from
Colin.
Facebook. Okay.
Colin.
Yes. Hey, cousin.
This is Lana.
Yeah, hello.
Hi. Listen, I was concerned about the mask, but you've explained it. Now, I walk outside. We don't have a shelter in place going on right now. So I walk my dog outside, and I walk miles, 2 miles, 3 miles. And I walk like 6 feet away from people. or I walk where there's no one else, like a back of a school. How much concern should I have with people running by me, huffing and puffing?
Yeah, so that's a great question. I think almost every day of our lockdown here in Shanghai, especially the first few days, I went outside to run at night. And the reason I did was there was nobody outside. It was empty. So it was like I had to run in the city. Now, if you're in a place where people are running, from what I heard, doing individual exercise is allowed. But I'll say this, Lana, the numbers they're seeing on TV now are based on what took place 2 weeks ago. So if they say, we have overnight, we have 10,000 more people who have been tested positive for the virus. Well, they caught that maybe 2 weeks ago.
Yeah.
So in your community, right?
Yeah.
People who are running, people who are walking their dogs, they might right now be coming into contact with something they don't know about. So I would say this: act as if you already caught something, right? Your dog will walk your dog in your yard. Okay, if you don't walk the 2 miles for the next few weeks, you will be okay. All right, but just try to contain yourself within the environment you can control, which is your home. Take your dog out to the back and let him do his thing out there. There's some great ways people have been doing exercise inside the home during this time. But if you don't have to go outside, don't do it, because I got to tell you, you don't want to get sick, because once you get sick, if you're by yourself, you're gonna be by yourself for a while. If you're not by yourself, you may infect other people in your home, and that may have longer implications. So you want to, my advice, you want to do everything you can to stay inside your house.
Okay, thanks.
Yeah. Okay, great. Any other questions?
I have lots of questions.
Colin,
Okay.
I have a question when you're finished.
Go ahead.
Yeah, so I'm calling to find out what has been the sentiment in China when someone catches COVID-19, and have you had any experiences where close friends have gotten it, and how are they treated as not just patients but as citizens, fellow citizens? Are they ostracized?
Wow. So, David, man, that's a complicated question, man. And I'm going to answer it honestly. Luckily, I don't know anybody who has admitted that they caught the COVID-19. I do have some people who have been sick, right, with the flu or something like that during that time. Now, luckily in Shanghai, well, let me start with Wuhan. In Wuhan, getting sick was really a bad place to be. And it wasn't so much about being ostracized. It was about what takes place after they find out that you are sick. Once you are sick, they must protect the community, which means that they must let people around you know this person is sick, right? We must now monitor you as well. So you can imagine that people were very nervous about being found out that they were ill. Also in Wuhan, I got to say, I have to be very careful how I say this. The local government wanted to make sure that they put a big divide between those who are sick, those who might be sick, and those who are not sick. So there was a big focus on doing everything you could to make sure that you didn't get sick, and if you did, trying to keep it secret. Now, as you guys know, trying to keep your sickness secret, that's the worst thing to do, because that means that if your family doesn't know about it, your friends don't know about it, they may come in contact with you, or you may just go out to the store and contaminate more people. Here in Shanghai, we did have a few cases in the area, and what they were putting people's name out there, and they found out that was the wrong thing to do, because neighbors would really start to treat their neighbors who were infected very differently, and be very concerned that you're going to try to kill my family because I have some senior citizens here, right? So the treatment was kind of bad. There wasn't a lot of negative feelings for those people, more feelings of concern. I can say now that we're starting to see the way out. Those who are sick, and I got to say, around week 5, the people who were sick, they went from being people you viewed as being sort of, to people who you are now proud to help them recover. Because initially, people were dying, right? And then and we really don't know how many people died. But then we start looking at, you know what, the doctors are heroes. The patients, we want them to recover. So now if you're sick with it, it's more about how to help them recover and doing everything they can to recover. So here it's not viewed negatively because the numbers are going down. I think if the numbers were still growing, then people would feel a certain way because they're thinking you're adding to the problem as opposed to, well, we can manage it now. Did that answer your question? Yeah, and I understand where I'm calling from.
Yes, it
too.
did.
You know, yeah, I'm in China, so I gotta,
Yep,
I gotta
understood.
be careful. Yeah.
Thanks for towing the line. I appreciate it.
Yeah, and let me add though. Let me add. In the U.S., I think you want to support the people who are sick, right? I understand what they're going through, and people will say, "Well, it's only flu-like conditions." That's the physical side. The mental side is very, very different, right? Knowing that you can put people's health at risk, knowing that you have something that's been on the news every day, people are feeling a certain way. And again, you don't know how each person takes being infected. And they may be they may say, you know what, now I can't go home to my family for 3 weeks, right? What do I do? Where do I go? I can't go to the hospital, can't afford that. So a lot of people are very concerned, and here they open up stadiums where they put sick people, and you don't want to go to a stadium. So in the U.S., I'm not sure what they're going to do, but I do expect that they will have some sort of area for people who are infected and don't want to go back home to protect their family.
Colin.
Yes.
My experience around me here is that people, and I'm in Georgia, as you know, a lot of people don't seem to take it seriously. And that is my concern, just about even my neighbors and the kids from all the homes are playing together. How do you educate people? Or my concern should just be me and my household and just leave them, because people are out playing tennis. Yeah, and just got the county commission to close the parks where they're playing. How do you what did the government do to get it to people? Because we have a bozo at the helm. I mean, it's not coming through as very serious to a lot of people.
Right. So that's a good question as well. And let me say, Lon, in the beginning, one of the things we talked about for the call, no political comments, right? We want to keep.
I can't help it.
I know, but no political comments. But to answer your question, I don't know any subject or thing somebody can learn overnight. Your main responsibility is you and your family, the people who are inside the house that you have, right? You want to make sure that they understand it and they're safe. You could really spend a lot of time trying to convince people outside your sphere of control what to do. Don't waste that time, right? Focus your time on taking care of you and yours. Now, the structure we have here in China and the US is very different. In China, once they say it's a restriction or a recommended restriction, overnight, it's done, right? Literally, it's done. So we didn't even have to worry about people saying, you know what, I feel da-da-da-da-da. The only people who went against the restriction in the beginning were foreigners, okay? Coming from, and they got dealt with very, very quickly. Right. So in the U.S., and I think it's wonderful, you have a choice. So what I recommend, what the government may do, they may need to make things mandatory and make it such that people have no option but to stay inside. I don't know how they would do that, but what that does, think about the end point. What that does, it does help to control and contain the spread, right? It does help to make sure that we're getting a handle of it. And I think people here understood that initially. So, well, one, they didn't want to get sick, right? But two, they don't want to spread it as well. So I would say, you spend some time trying to educate people, but take care of you and yours. And I think hopefully their own families, and as more news comes out, they'll start to take it serious. And they will take it serious because they're going to see some things taking place. Again, what you're seeing now happened 2 weeks ago. Yeah. So you will start seeing some things where people start taking it more serious, I think.
Okay.
Yeah. Okay. And one thing I forgot I asked, but you guys didn't really do is I want to know, what is your current concern level, right? So Michelle, I'm going to ask you this question. I know you're calling from Maryland, but what's your concern level? Blue being not concerned, yellow being I'm getting a little nervous, red being I'm really starting to panic.
Okay, so I want to say probably about 4 days ago, I kind of hit my severe red volcano. I was taking in way too much information and reacting, and it wasn't in a very positive way.
Right.
Towards it was myself, and I was adding way too much concern to my mom and obviously to my son as well, because I'm a single mom, and so I'm the only caregiver for him and technically the only caregiver for my mom, even though she lives across the Bay Bridge. There's still the concern for taking care of what she needs. I had an awful dream the other night, and it was very vivid, and it was an invisible demon that I couldn't handle, and there was the words that I couldn't speak, and then all of a sudden I shouted them out, and of course it woke my son up, and it was love twice, and I woke up the next day and I realized that I needed to change my color. It had to come down from red. I needed to be in red for a particular reason in order to, take the precautions necessary. But it had to come down to a yellow for my own sanity, and for my son's sanity and everything like that. So, I mean, we're taking the, certain precautions, but I've had to have more distinct conversations with my mom who, because she still wants to go couponing to 4 different stores. So we have to have very unique conversations about how she can protect herself with a heart condition. And my son as well, who doesn't understand being cooped up. And so we've come back down to a yellow, and I think we're probably going to stay there before we would go anywhere close to a blue is going to be at least a couple of weeks.
Yeah. Well, Michelle, you made a breakthrough, a very quick breakthrough, right? Because as I talked about earlier, what you went through, starting to feel that panic and knowing you have to sort of change your behavior, that took us around 6 weeks, right? So I commend you. That's very, very fast. And you're right. You have to be, because you're the head of your family. You really have to be the calming agent in your household. My wife came to me probably around week 3 and said, honey, I'm going crazy. All this news is making her very paranoid and very panicked, and she's getting very anxious. And I said to her, I said, honey, at that time I wasn't so worried. I said, honey, just turn off the news. Because I can't. I must know what's going on, right? I mean, all day she wants to know new numbers, this, that. But what she did, she then said, you know what? I'm going to watch the news at certain times of the day. Become informed, right? And that's what we've done. Right now, she still listens to it a lot, but she's much more calm, much more panicked. And each day you go and have those things you're doing inside the house to protect yourself and to protect your mother in her home, you'll start to feel and maintain a level of calmness. Yeah. So I want to add one thing. Just 2 terms that we coined here. So families go through different experiences in their homes. The first term, I told my wife last night, I said, look, I guarantee you, come September, October, November, December, January next year, you're going to have all these quarantine babies, right? All these babies being born due to all the time everybody's cooped up, right? And my wife, who's always a step ahead of me, she goes, no, honey, no. In China, we already have a term. I said, what's that? Quarantine divorces, right?
Yeah, I believe that. Yes.
Yeah. And she broke it down to me. She said, honey, understand something. A lot of people who are married here, they've never really spent alone time together on a daily basis. Mm-hmm. Somebody goes to work, they go on vacation, they're doing this, doing that, doing this, doing that. One person, so now they're cooked up in the house with the kid, with the in-laws, right? And arguments happen. You got to pick sides. Who's watching the kid? I mean, they already are filing for a number of divorces here. And I hope that in the U.S., you know, we avoid that. I told my wife, I said, well, in the U.S., people have their spaces in the house. House is a little bit bigger. You may have your little space here, a little space here. In China, no. It's a small place. And Tabani knows this. You do not have that much privacy here. So imagine being, you know, 6-7 weeks cooped up in a house with people who are getting on your nerves, right? Interesting. Okay, next question or comment. Well, actually, let me ask somebody else. So, Simbani, I think you're in Missouri, St. Louis, right?
Kansas. Yeah, so I mean, Colin, my concern largely, obviously, my wife is a healthcare worker, and obviously at this point they don't have the supplies of the N95s or any of that stuff. And she also happens to be on call this week, so she's overly exposed, right? So she's you know, spending more than 10-12 hours at the hospital on each day. So, and then of course with the US family structure being sort of smaller, if any one of us gets sick, that becomes problematic very quickly.
Right.
So, yeah, so I mean that's really my where I'm at. I would probably say that, you know, I'm still in the yellow zone. That's just because of my personality. Right. But certainly much more worried about my wife being out there.
Yeah, and I got to tell you, the heroes of the whole thing here in China were the doctors and nurses. Right, they were the ones who proved to be the heroes in some cases, because they were really exposing themselves. And I know that a lot of doctors were exposed. Most recovered. And the issue with not having the proper supplies, rest assured, man, they will be there. Right. One thing that other countries are doing, they are sending supplies all over the world. So they will have the supplies they need. Now, hopefully, in that gap time, they'll be able to protect themselves the best they can. But I want to definitely, you know, give a shout out to your wife. Now, one thing that we did here in China, there was an immediate separation between caregivers and their families. So they opened a hotel, and the hotel was where all the doctors and nurses would go after their shift. They would no longer go back home. So you had doctors from all over China going to Wuhan, right, to provide care, and they stayed at hotels. Now the doctors and nurses in Wuhan, a lot of them got sick initially. But the ones who didn't, they also were staying away from their family. And it did bring initially a lot of stress. But then again, they changed the picture and really put these caregivers up as the heroes. And the community really got around that and started really taking care of the families, taking care of the caregivers' families, bringing them food, making sure that everybody stayed upbeat. So I think we're going to find in the U.S. that the first wave of protective gear will go to the caregivers, and we'll really start looking at these people as the ones who are literally putting their life on the line for the rest of the U.S. So, you know, big shout out to your wife, and I hope that they're able to get what they need over the next few weeks. Yeah. Does anybody else want to share their current feelings and their current story? Hector? You're off mute. How about you? How you feeling?
How are you?
I'm good.
Thanks for this platform. Thanks for sharing your experience, man. I'm glad that you're doing well and your family are in good space.
Thank you, brother.
For us, it's been a roller coaster ride. So I guess I'm on that yellow, red, but like you said, I try to keep level-headed through this whole thing. My wife is constantly on the view, watching updates of this virus thing, and I know she's very intense about cleaning. She's always been that way. So. We're kind of safe, but I implemented a few of your tips and tricks as far as coming into the house and have a designated area where we kind of disengage.
Right.
In that manner. I did buy gloves like that to keep in the car. Also, did some Clorox and keeping the car and do some disinfectant. And I usually do most of the grocery shopping.
Okay.
But when I go, I pick up and, once I get back in the car, wipe things down. But sometimes I get the habit of just by nature trying, something gets in your eye, your face gets watery. You naturally do that. That's you got to be cognizant of that. Outside of that, we're trying to keep calm. A lot of my family are still in New York, so in Brooklyn, and I check on them daily, to make sure that they're okay. It's been contained. I'm in Jersey, just over the river, so I'm still close, but for the most part, it's been contained in New York. And then my dad, who lives in Florida, he's by himself, but he's pretty much in good health. So he's doing well. So I keep in contact with him as well because he's, like I said, he's by himself, retired.
Right.
So yeah. But again, man, thank you for sharing your platform, sharing this, and it's helpful. It's good to see that you're in good health, you and your family.
Yeah, I appreciate that, man. I think, as you mentioned, the folks in New York are going through something a little deeper. I think what's happening in New York could be a lesson, or should be a lesson to other folks, right? Especially how New York really plans to manage that situation. And with your father in Florida, I definitely hope he's taking care of himself, especially being alone and by himself. I think if I had to ask you guys to do something, each of you guys, contact 5 people right? And help them, ask them what support they need. Because during this time, even on this call, Hector, you said you're in that yellow, red. Michelle, you used to be in red, now yellow. Alana, I think you're in red. Tabani, yellow. So everybody is a different level of concern. You want to make sure that you guys are there for your family and friends for them to talk to, and also offer them good tips. Share what you're doing, right? Ask them, what are you doing? Ask them, what, is everybody in your house really following these rules? Right? Help them talk about it and maybe recommend some things they can do. At the same time, they may have some good ideas for what you can do, right? To better protect you and your family. This is going to be, based on what I went through here, experience here, this is going to be the new normal for a number of weeks. And again, the reason is, in order to control, let me share with you how this happens. If they say the virus can last for 14 days on surfaces, or you can be a carrier for 14 days. Sometimes you don't have any symptoms, and sometimes you don't become contagious for a number of days. So let's say, for example, I have something, I come back for the first week 1, we're fine. I may then, pass it to my spouse or my child. They have 2 weeks now, so I'm looking at 3 weeks, right? Now, during that 2 weeks I passed it, they may not have any symptoms. They may pass to somebody else. So you have to understand how this thing can just go boom, 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 and piggyback. So I do think that in other countries, it's going to be a period of tightness for, at the very least, another month and a half. I would add, in those countries where people are still outside skiing, walking their dogs, playing tennis, doing all of that stuff, it's going to take a little longer as well, right? So the best thing you can do is not be surprised or shocked by what takes place. And that means communicating with your friends and family and having a plan in place of how to protect yourself. And again, protection starts in your home. Right. Okay, we have about 15 more minutes, and I do want to make sure that I get everybody's comments or questions in. And David, you mentioned you had some questions in the chat. I haven't looked in the chat. Let me look.
That's fine. Yeah, that's fine. One question I had was for, do you have any information on the different demographics, how this pandemic is affecting different, not just age groups, but for example, teenagers versus middle-aged versus elderly, as well as young ladies or elderly, middle-aged ladies who are pregnant. How do you know? What is the impact on those demographics within our society?
Right. So let me say that I'm not a medical doctor, right? And I say that the information I give is strictly based on what I've seen and experienced. So I can't speak on this from a factual standpoint. I can only do it from a experiential. Yeah. Initially, there was a rumor saying that African Americans were not catching it at such a high rate. Now I think that's because in China there are not a lot of African Americans, right? So the sample pool was very, very low. But we are seeing now that more African countries are getting affected, right? More African nations are getting affected. So I don't think that from a well, not term, from a not racial, from a I forgot what the term is. Whether you're what is it? Ethnicity, right? I don't think that plays a role. Also, initially they said more senior citizens, people above the age of 55, are catching it, and young children were a little more immune to it. But now they're seeing numbers. I've seen reports that are saying across the gambit, people are catching it. I think in New York, a lot of folks in New York are of that younger age. As far as being pregnant, we do know that there were cases where women who were sick while giving birth, their babies were fine. There's also cases of women who were sick giving birth, their babies also were sick. So I don't think there's a pattern. I do think if you do some Googles, there may be some information online. So I don't really know those numbers. But I think now what's being proven is that anywhere for anybody from a young kid to a senior citizen can catch. But some age groups are more carriers and may display less symptoms, but you have to look up to see what that is. I don't really know those numbers.
Thank you.
Yeah, and David, what's your, if you don't mind, what's your, I mean, where are you now, and what's your sort of level of comfort?
Yeah, so I'm in Silver Spring, Maryland, and my level of comfort, last 2 weeks ago, my company, the NIH, sent us home 2 weeks ago, and the telework, and we're teleworking until May 1st. So it moved from April 1st to actually end of May. So it's that level of so for me, I'm working from home, and I can tell you I've been going out once a week at this point, from the day that I started 2 weeks ago. So for example, last week Friday, I went out to get some food, and that was the first for that week that I went out. And you just try to limit your interactions with people. When I was on the roads, there weren't a lot of people on the roads, but there were people walking around with their dogs and with, going to exercise and other things. But as of yesterday in Silver Spring, well, in Montgomery County, they shut down all the non-essential businesses within the community. So that means anyone that's not non-essential needs to stop operating, or they'll be fined. So we are seeing signs where things are ramping up as far as the response, the community, the local government's response. And so I'm just following those patterns, those waves of things that are coming down. But we do see, because there are 50 states, different states having different levels of responses, and luckily we're in a state that takes it a little bit more seriously, so they're actually more quicker than other states.
Yeah, David, first of all, thanks for sharing that, man. And I'm glad to see your company NIH is having you guys telecommute, work from home till May, right? Clearly over the window. That's very forward thinking. Are you able to, or what's your tips, or if you can give us some pointers, how are you able to stay productive while you're at home? I know the big a lot of people, the big thing is, do I focus on work or focus on watching the news and protecting my family? How are you balancing that?
Yeah, so we are working, so it's not like we're just off not working. Some individuals are off because they're working jobs that are physical and they can't work from home. But for the National Institutes of Health, all over 10,000 employees are teleworking across the government. And so they already have things in place, all the virtual meetings, whether it's Zoom or GoToMeeting, to facilitate collaboration, as well as SharePoint, Microsoft Teams. So we just use technology to support being fully virtual. Some stats that I got from the first week, on a typical month, NIH normally has 25,000 GoToMeeting calls. But in the first 5 days that we're teleworking, they had 5,000 virtual meetings per day. So it adds up, and these tools are there to support that capacity as the workforce transitions to fully online, and they're not breaking in any major way. So that's how we're actually maintaining the work-life balance But as you said, you cannot watch TV all day because it will be like a 9/11 where you're just glued, and you start because the news is so sensational that you kind of get glued into it.
Right.
And you have to kind of monitor your pulse and detach when you need that space to calm down.
Yeah. Thank you for that, David. I think it's great that you guys have a routine, so to speak, right? Maintaining your work, and sometimes having that routine helps the day go by faster and helps create that level of calm and routine in the household. So thank you. And Dexter, I see your hand up. I want to go to a question.
There's a question in the chat that I think it'd be good for you to comment on. So the question is, can you comment on availability of mask use of homemade masks to at least provide a barrier to the virus?
Yes, Michelle, great question. Dexter, thanks for reading that out. Don't use a homemade mask.
Oh.
Okay. I don't know the first time you ever tried a new recipe. It can be terrible, right? Homemade stuff don't work sometimes, and you know the reason why these masks are being produced and by a certified company is because they must have a certain level of proven protection. The homemade mask will do one thing and one thing only. It'll prevent you potentially from going from your hands to touching your mouth and touching your nose. Hopefully, though, in your home, you have already disinfected things, so you're not worried about touching your body parts, right? Please disinfect yourself, disinfect your home, because at home you want to be able to move around freely. You know, we don't wear our masks inside the house. Now the masks have run out in the U.S. in the first few weeks here. You cannot find a mask in China. Luckily, we bought some before we came back to Shanghai. But about 2 weeks ago, we can now start buying masks here. Now, the reason why we're using masks in China is because the Asian culture have always kind of used masks, right? If you have a cold, you wear a mask on. So it's not a big deal here. In the U.S., they're saying you don't have to worry about masks, and I agree. The masks are really for folks more who are sick, preventing them from contaminating other people. If you don't have a mask, that's fine. Just make sure you're sanitizing yourself frequently, your hands and whatnot. When you return home, go through the process we talked about earlier. When you're outside, try to touch your body parts. But I do think masks will be available again in the U.S. at some point. I don't think anytime soon. And I'll tell you why. If masks are available, they should be going to the hospitals, to the nursing homes. They should be going to people who have a much higher risk of infection, not to everyday people who shouldn't even be going outside in the first place, right? So the listeners, don't use a homemade mask. And we've seen some very intriguing homemade masks, like taking a woman's brassiere and using that as one cup. We've seen people using underwear as a mask, right? There have been a lot of funny homemade masks, but I would say, you know, don't really use the homemade mask. And if you read up information, the scientists will tell you it's more about washing your hands than it is about anything else.
So can I ask a question, Colin?
Absolutely.
I think Gordon is still working, so I'm sort of concerned, and he's sort of concerned. I think his worry is way up because he doesn't want to contaminate me. Right. And so he's downstairs, and he isolates himself down there. Like right now, I say, come and see your cousin. And he's like, I want to isolate myself from you, because he just feels that something is going on. Right. And I don't know what to do other than, you go talk to a therapist or something. You don't want to go crazy because of this. You got to go to work, or if you don't go to work, then, they'll fire you. Right. Or I don't know how to handle that, but he's concerned.
Yeah, I would say the first thing is, provide him somebody to talk to, whether that be another family member, whether that be a coach, a life coach like myself. I think life coaches are great because we don't have the stigma of a therapist, right? So you don't have to think that you're a lot of people go to therapists and think they're going through a problem. Well, no, it could just be you just need somebody to talk to, right? But provide somebody and tell me about Kevin, contact me, right? But I think as far as himself, what's the word you use? Self-isolating?
Isolate.
Yeah, be careful there, because he may still be going to the same refrigerator. He may still be using some of the same utensils.
Yeah, but we clean down every time.
Right. And I would say if you have a process that you're using to clean down, you should be okay. But if he is working, I'm quite sure he's feeling a lot of stress of two
Yeah.
things. One, he may be coming in contact with something he doesn't want. Two, he wants to make sure he's getting income. And a lot of people are going to be impacted financially. And as you guys know, when you're impacted financially, it turns into being impacted emotionally, right? Because now you have a fear of losing a job. And some folks, a lot of people need that continual income. And the money that you may get in the mail from the government, that may not really help as much. But because, again, you still may not have a job. So a lot of folks have to work. Delivery people have to work. They are very important right now as well. So with people like that who have to return home to their families every day, I do think what Gordon is doing may make sense, right? Making sure that they have a separate entrance, a separate place in the house where they maintain, because again, they may catch something or may pick something up today and not know for a number of weeks. So they have to go back outside on a daily basis. So it does make sense for them to have their own space, but you really want to make sure that you're really doing a thorough job of disinfection as they move about the house.
Okay, thanks.
Are there any types of products that you use to disinfect?
Yes. Unfortunately, they're all in Chinese, so I don't know what they're called. I talked with somebody yesterday who said they were using Lysol. Right? I don't know if Lysol is, Lysol. I don't know. I mean, have you heard anybody using Lysol? Did that make sense to you guys?
To disinfect?
Yes.
Yes.
Yeah.
You use Lysol spray. You use Dettol if you have Dettol.
Okay. Now we have Dettol. We use Dettol. Everything in our house, we use Dettol. I call it Dettol. And we wipe everything down with that. And that smell is like my cologne now, right?
That's all right.
Nice.
We use that a lot. We have three things. We have a mist spray we use for our shoes, right? We have a pump that we use, alcohol based. It's very similar to the what you call the
hand sanitizer.
It's a little more liquid, not a gel form. We use that, and we have the best thing out there: warm water and soap. Right?
Great.
So we have a lot of things that we use here to disinfect. Yeah. All right. Okay, we got about 5 more minutes, guys. Any major concerns? I hope you guys are looking forward to spending a lot of time at home with your families. Just one of the things that a lot of our friends here did, tried out new recipes, right? Tried new things cooking. Tried to have family cooking together. Kay and I got by doing a 500-piece jigsaw puzzle. And what that does, it really brings people together. And as you walk by, you may put a few pieces down. And so finding ways to keep your family busy and, more importantly, in a positive mindset, right? That's the most important thing, because you want to make sure your immune system stays high. And that's really two ways. The food you take in, the food you put into your body, the exercise, and the mental food you put into your body too, right? Being careful of the news you're watching, making sure you're watching something funny, right? Funny, making sure you're laughing, making sure that you're really still making the best of being inside.
So real quick, Colin, on that point. So not sure how much time you and Kay spent in the home prior to this, but what is probably, you don't have to be personal, but what's one good thing what's one good thing from the time that you had to spend? And then what's one thing like you're like, good Lord, I got to get out of here?
Woo-wee. Well. Okay, to be honest with you, I'm going to go to the second question first. We were in South China. Let's mute somebody here. Okay, so we were in South China when the Wuhan outbreak came across. So we were actually on holiday for Chinese New Year in Kay's hometown. I needed to get away from Shanghai for a few weeks. So I was looking very forward to being out of Shanghai. We were going to go in Guangdong, to go to Hong Kong. So we came back after a week. because we wanted to make sure that we were at home in case the city got locked down and in an environment we can control. So the first week I was back here, I was miserable because I did not want to be back home in the city, right? She's from the countryside, okay? I mean, you know, you have chickens and everything in your backyard, right? Countryside, right? So I loved it out there. It was warm, it was beautiful. So the first week, I wanted to get outside. I went outside every day because I just needed to get some fresh air. But beyond that, I can't say there was anything drove me to get out the house. What I enjoyed the most about this time, quite frankly, what I enjoyed the most was really being there for other people. After that few weeks, after the fair, a few weeks were past us, again, a lot of people were starting to feel a little pressure and needed somebody to talk to. So again, using Zoom, using different applications, I was able to really be a support for a number of individuals. And I think that's the biggest takeaway. I mean, like I said, I'm a life coach. That's part of my job. But being able to talk somebody off the ledge, so to speak, in 45 minutes, I think that was very important, because if you're able to, you know, like Michelle said, you're the head of the household. What you do is it replicates to everybody in the house. If you have bad energy, your whole house is gonna have bad energy, and you don't want to be stuck in the house with bad energy. We went there. Trust me, you don't want to do that. But part of the process is maybe you have to do that anyway, right? So being able to help people sort of have the positive energy and really ask the question, what are you really, really afraid of? And we found in most cases what they were afraid of was something that they couldn't control anyway, right? So the fear sort of went away. It went from panic to fear to concern. Being concerned is fine, right? But the fear and panic is, so being able to help folks sort of come back from that was the biggest thing I enjoyed and I'm still enjoying from this time. And quite frankly, Dexter, this is the main reason why I'm doing these videos and articles and whatnot, to really help people, to maintain their self during this time, because I do think it's going to be a quite interesting time for a lot of folks over the next few weeks to the next few months.
Last question for you. Well, for me, is there any data around the impact of the entire population staying in for a couple of weeks on end? Like at this point, you're on week 9, in terms of vitamin deficiencies or any other types of ailments that might be attributed to being inside or indoors for a long period of time?
No, so far, no, because we're still at the end of it. Even though people are going outside more, we're only probably about 2 weeks out of people really, really staying inside. I think in a few months they'll crunch that data and have information. From my peers, I don't think that we've found any. I do know that the first few days the parks are packed. People really getting back outside, but as far as what physical or emotional toll it took, I don't know. We talked about the quarantine divorces. That's a real thing, right? We know that some people had some tough time really maintaining, but I don't have any data that speaks to the physically being inside, not being physically being inside for that time period. I don't have any data for that. Okay, guys, we're getting to I want to stay true to the time here, but I will answer each question. So Michael, I have a question here. How are the precautions for people in rural outdoor areas different from that for us in urban settings? Can you spend more time in wide open settings? So in China, no. So the question is, so people who are in a densely populated place like a city versus something more rural, well, there are different regulations there. And I would say no. Across the board, people are told to stay inside. In the city, you understand why, right? One person can infect a lot of people. But also in a rural place, one person in a rural place, you still have that family structure. So one person gets sick, you still may infect your family, but you may not have access to adequate medical support because you're in a different sort of environment. And there, I can tell you the supplies aren't going there. So if somebody's sick and they go to the doctor there, that really is going to shut down that area. So across the board, it was stay home, stay inside, protect yourself across the board. Great. Okay, so any other comments? Or I'm going to unmute everybody here.
Are you going to do this again, Colin?
Okay, everybody unmuted. I mean, do you think I should? What's your thought? Should
Yes.
I think you should.
I think this was
Very useful.
helpful.
I? Okay.
Yes.
I know we're going to get some boneheads to come on.
Yeah, absolutely.
Yeah, we'll corral them.
Yeah, and guys, I do have to do a what I call a not shameless plug. As I mentioned, I am a life coach, and part of the great thing about being a life coach during this time is, again, I was able to really help a lot of people get through this time. And, you know, like everything, the peaks and valleys of your emotions, what you're going through. So having the experience of going through it, plus being a life coach, you know, it puts me in a very unique position to really be able to help folks very quickly. So if any of you want to speak more about this, we will find information after the call. I have your email, so I will be sending out most of the emails, but I will be sending out information on how to contact me. And again, the big thing here is getting support. If you don't contact me or another coach, talk with somebody. If you're in a great mood, talk with somebody, put them in a great mood, right? If you're down, talk with somebody, have them pick you up, right? The main thing is communicate, and support each other. So I'm going to say this, www, if take out your pen, take out your pens, right? Take out your pen, www.oligye.com, oligye.com, oligye.com. That is my website, and you'll see information there about life coaching. And I have updated that with information specifically about COVID-19 coronavirus support as well. Also, a set of videos that I've done giving tips and pointers. So, guys, I want to thank you for your feedback saying that this was valuable. So, if this was valuable, can you do a thumbs up? Great,
Very
great.
valuable. Thank you.
And I got to say, I want to be as tough and bold as those doctors, as those nurses, as those delivery people, as the folks working in grocery stores, and do everything that I can to support you guys through this time as well. All right.
Thank you, Colin.
Thank you, Uncle Colin.
Thanks, Colin.
Much, Colin.
This was very good, guys. Thank you,
All
Colin.
right. Talk soon, guys. Bye-bye.
Love you, bro.
Bye.
Talk to you later.
Thanks, David.
Yeah, man, no problem.